Hans holding tight onto his bike after accepting the fact that it would be long before getting the attention he seeks, this man decides to have a nap which might end up being longer. He is not the only one. Many people who are seeking the service he wants have also found spots to sleep. Granted, there are beds to fill up a ward in this health center 4 at which they are, but they are very small wards.
When we have bigger numbers, actually you get people sleeping almost actually on the floor.
They are lucky where they are. The bushes have not yet invaded the space, as it is with most health facilities in the newly created district of Kibuku. And getting here, they trek for miles.
At times they tend to remain home because they fear to move long distances. And even the outreach, those ones are, although they are there at times, but they are not consistent because of the facilitation.
Throughout the district, this health center 4 is almost the only functional health unit.
And it is the only health unit where we have art services. And a day like today, we have art clinic. So you will get a congestion.
The congestion is however not matched by the health workers. The district does not have any doctor. Midwives are also not enough. There are only 8 out of the needed 18.
And if there is only one midwife in a health unit, you can imagine the burden this midwife has.
The health center 2s, which were built in Naluemba and Bulangala sub-counties, were to beef up the health service delivery, but they are not operational. The district is asking for room to recruit more health workers. However, the Minister of Health asserts that each district is well facilitated to cater for recruitment.
I think what has happened in a situation like Kibuku, you are yet to study why they are not recruiting. There is a provided staffing norm, and I am not sure whether they have exhausted it. They are supposed to have a doctor. Even when they're a new district, they are supposed to have been a health sub-district previously.
We have tried several times to appeal to government. We even went to the ministry. They advised us we source a private doctor. When we consulted, that person wanted 4 million per month in extra to what is going to be given. As a local government, our local revenue is very small.
The concern, however, is whether the creation of new districts is also in a way limiting service provision in the country. And according to Dr. Lukwago, maybe there will be no need for health facilities for many of the diseases if the people started following simple doctors' orders.
Agreeably, like everybody has talked, about 80% of the diseases could be prevented through immunization and hygiene. Yeah.
So like people should not even get sick because they're getting sick.
Yeah, the best would be don't become sick. And if there is a mechanism of a disease which you can prevent by taking up that message, please heed and actually avoid being sick.
However, when people do not heed the orders, they need service nevertheless. In the ministry's plans, Kibuku Health Center 4 is among the over 20 health centers in the country which are going to be worked on in health service delivery under the World Bank project, which is to rehabilitate and expand 2 regional hospitals, Mubende and Moroto, 17 general hospitals, and over 20 health center 4s.
And you know the constitution is clear in Uganda. It provides you to submit back the authority which you are not able to use. We have not seen any cow telling us that we are submitting the health services back to the Ministry of Health. They are interested in a budget which they criticize, but they are not interested in the handing over responsibilities which they have failed to operationalize.
The ministry is ready to raise such failures to the cabinet, appoint own staff, and directly supervise them, which used to be the scenario before a decentralized system in health was created. It appears like Kibuku district may be the first district to hand over the health delivery system to the Ministry of Health, considering the burden they face with non-functioning health facilities, inadequate staff, and overwhelming patient numbers. Florence, NTV.